There we go. I think we're live.
Hello, everyone. Hope you guys are having a wonderful day and enjoying the beautiful weekend weather, I should say. So for those of you who don't know me, I'm Fatima. Today, we're going to be talking about heart health with Dr. Theresa, and I'll let John take it away.
Hi there, everybody out there. And yeah, my name's John. And so we have again Dr. Theresa coming on every month. And today we're happy to have her again. So I just want to share a little bit about Dr. Theresa, those that are meeting her for the first time. She's a certified functional medicine chiropractic physician whose life purpose is to solve for patients' health issues through balancing their biochemistry with natural compounds such as herbs, vitamins, minerals, neurotransmitters, bioidentical hormones, chelators, binders, phytonutrients, and more. She focuses on advanced testing procedures and an extensive health history to create an effective treatment plan for her patients. She was a research scientist at a pharmaceutical company and has dealt with her own significant past health challenges that only improved through natural means. She's raised two beautiful young daughters, two young women, and is the owner and director of Health Up Institute, previously known as Health Up Wellness Center since 2011. And she's an active lecturer, educator on many health topics, and is a international speaker on iodine therapy and its vital role in our health and healing. Besides her chiropractic doctorate degree, she has a Bachelor of Science in Chemistry and a Master's of Science in Environmental and Industrial Health from the University of Michigan. She's a lifelong learner and with an open mind of combining science with energy medicine, as well as she's been trained as a Reiki master teacher and yoga instructor. So let's bring Dr. Theresa on and welcome her to the Healthy Way Vibes.
Hello, Dr. Theresa.
Hi.
Thank you. Yes.
Hello.
How are you?
Good. Yourself?
Good.
Wonderful. Absolutely wonderful.
Well, I see you've got the color red on for Heart Health Month. I don't think we got the memo.
We didn't get the message. We're doing the show,
we missed out on that one.
That's a little heart. Yes.
Find something.
So tell us about the heart. I mean, yeah, that's a huge topic, and it's a very important topic. And that's what sort of keeps us going, alive and kicking. So tell us about it. There's so much to know.
Absolutely. You know, your heart, which we take for granted because we don't think about it. It's an automatic function in our body, just pumping away from conception, which is pretty fascinating. And so it's critical, obviously, that this pump keeps going. So the rest of your body receives the oxygen it needs. If it doesn't have the oxygen, you're dead in minutes. So nobody wants that. We really need to keep the heart strong and not take it for granted. So several things I really want to talk about today, and a lot of it seems to overlap, is really educating people on, there's actually 4 stages of heart disease. And within those stages, it is understanding your risk factors, and then what prevention measures you should do. We'll discuss a little bit about blood work, what kind of blood work is best for your heart. But people don't understand cardiovascular disease is the #1 killer worldwide, and it's the #1 killer in the United States. However, it goes back and forth with cancer. So sometimes cancer is #1, and then heart disease is #1. I mean, this is not something we want to win here. So we want to just decrease all of that. But later on, when we're talking more about some risk factors, there's some more recent scary data that's kind of what's been going on due to the pandemic, which I foresee an increase in more heart disease. However, the good news is the preventative measures to do, many of them overlap for both preventing heart disease and cancer. So you kind of get a double bang for your buck. You're learning about heart disease, but all these prevention measures are also very good for preventing cancer.
Mm-hmm. What kind of tests would people start to look at? Like, what are some of the tests that you would usually hear people taking, or when they're just starting to maybe, or I should start taking care of looking at that area?
There are many good tests. Now, I think actually a while back, if you go back and listen to some previous ones, I think it might have been the November one, we're talking about preventative medicine, and we brought up EKG, getting an EKG of your heart when you're healthy. You want to deal with your health when you're healthy by looking at various markers to see if you're moving into any risk range, and also to have baselines. So an EKG for the heart is something very important. And ideally, around age 30, if you're older than 30, go get one, 40, 50, because you should be healthy and you're going to see what it is. Now, I'm not an expert at EKGs, but a cardiologist can really tell a lot by the interpretation of the various QRS intervals, the P interval, all these different things. And if it's slightly off, then one, of course, you've got to watch it, but it may provide some self-motivation to do the preventative measures. Then, blood work. So definitely blood work is very important. And a lipid panel is what we generally associate with looking at the heart. I'm going to talk about what should be in the lipid panel, but overall, because everything is interconnected in our body, inflammatory issues, it's going to cause issues everywhere, which including the heart. If the kidney is under stress, because actually one of the risk factors, so instead of just talking down risk factors, we're kind of peppering them in kind of here. But chronic kidney disease significantly, increases your risk of heart disease, and having a massive heart attack or a stroke. So these things can also be found on everybody should get these yearly done. Your CBC, which is your complete blood count, your CMP, comprehensive metabolic panel, look at your kidneys, your liver, all that's going to interact. Your vitamin D levels, there are a lot of studies that are associating your vitamin D level significantly with inflammation. So of course, lowering inflammation is going to lower stress on the heart. Looking at your vitamin B12 and folate. One of the vitamins people forget all the time, we check B12. That's becoming a lot more common. Do you want to at least, if you've never checked it, check folate? Because folate and B12 have a very special relationship. And folate has a very important job for the heart, is to get rid of this really dangerous amino acid called homocysteine. And you can get in what's called it's like a B12 folate trap, it's called biochemically, where you could take a lot of B12, where some people kind of go too gung-ho on their supplements and everything kind of looks okay, but their folate levels are actually low. And so their homocysteine levels start going high. And so you want to check what your folate levels are as well, at least a one-time, situation. And then other inflammatory markers like sedimentation rate and C-reactive protein. Now back to the lipid panel. So we'll talk, I know I said in the beginning about the 4 stages of heart disease, but this all coincides because that pre-stage, that first stage, which you have no symptoms in, if you look at these markers, you look at the blood work that we're talking about, and we're going to talk more about, will let us know where you're at. Are you truly in this stage 1? So looking at your total cholesterol, looking at what's called your high density lipoprotein, low density lipoprotein, your ratio of total cholesterol to high density lipoprotein, and your triglycerides. So your total cholesterol, ideally they want it less than 200. They want your HDLs, which is very, very important, to be greater than 50. I mean, ideally 60, 70 would be great. And your LDLs less than 100, your triglycerides less than 100. I think LDLs might have a little bit bigger range. But what those represent, your HDLs are your good cholesterol, and they're very dense. And your LDLs, they're not necessarily bad. I don't like that label, good and bad, but your LDLs are these big fluffy guys. And they are actually very important because they carry nutrients that you just digested out to your tissues. So you need HDLs. So on a sidebar, yes, you can have too low a cholesterol. I need to note that. There are a lot of studies less than 150, which at least here in the States, work with your cardiologist, but think about this and do your own research, that less than 150 is highly associated with other health problems like autoimmune diseases and cancers, because it significantly decreases all your steroid hormones, which is your testosterone, your estrogen, your cortisol, your pregnenolone. They all come from cholesterol. So don't lower cholesterol too low. But anyways, the LDLs take nutrients to your tissues. And then your HDLs actually come and clean up any gunk, proteins and stuff that were left behind. So that ratio is very important, to have enough HDLs, enough, people who clean things up to come through and clean up. So you've got your delivery, people, and you've got your cleaning up people. And as long as that ratio is good, you generally don't have any issue. And there's some studies of, cholesterol way high up to 300, but people have amazing HDLs like 120, and the LDLs and the ratio. So it's something to really discuss with your doctor, but it's all about having those ratios. If you are
is there a specific ratio that we need to keep it in with our HDL and LDL?
Yes, they've now transitioned more to looking at total cholesterol to HDL. Seems to be a better marker. So just because your total cholesterol also has other things called VLDL and, just stuff in there. So they take the total cholesterol because all that could leave stuff behind and how many people are cleaning it up. So you definitely want less than 5. Total cholesterol divided by your HDL. Average is less than 5. Who wants to be average? Ideal is less than 3.5.
3.5.
So that's really what you're looking for is really getting that down low. But if you have a high risk, other risk factors, think about hereditary heart disease.
Mm-hmm.
And how medically that's defined is if you had a male in your family, kind of called like a first generation, meaning a brother or your father, but I'd even consider an uncle, that if they had a cardiovascular event, heart attack, stroke, less than age 55, big red flag to get checked. And then if a female in that same situation, a mother, a sister, I'd even say an aunt, less than 65. So that's the hereditary component. I mean, you could have congenital issues. A lot of times those were figured out when you were younger, if you had heart valve problems or other I forgot the word, issues with the heart muscle, myopathies. Those can also exist. So you want to take that into account when you're looking at blood work, because there's more called ApoA and ApoB. ApoA1 is actually the major protein for HDL. ApoB is a major protein component of LDLs, and you look at those ratios, because some people just have hyperlipidemia, meaning genetic high cholesterol, but those other ratios are beautiful. So those are big factors, blood work to look into, and the EKG for your heart. But again, it overlaps. Knowing all those other markers helps you actually know a lot about your health regarding cancer and things like that.
Right. So it seems like there's a lot of factors. Like our heart is just kind of, it's somewhere in that system. It's somewhere in that traffic jam, right? Like things are going through it.
Oh yeah.
But that is it can be affected because our heart can overwork, right? You want it to be working efficiently and optimally, but the heart can be overworked, and things can factor into how stressed it is because of all the other maybe health concerns that we have, like you mentioned, right?
Oh yeah.
So it's trying to adjust, but it can only do so much.
Exactly. So often that preventative stage, those risk factors, smoking is number one. There's oodles of studies of how dangerous smoking is for the heart, the stress directly on the heart. I mean, besides linking it to many cancers and things like that. But if you smoke, you need to get help to quit, because smoking is an addiction. It is challenging. It could be a part of your social situation, whatever it is. But if you care about your heart and living long, you need to stop smoking. Being overweight, having high calorie diets, very stressful on the body. Looking at your body mass index is important. But that's you can do a calculation online. You can go to Google and check your body mass index. That's kind of your height to weight. But what's more important is your waist to hip ratio. It's different for men and women. Men are allowed to have a bigger waist to hip ratio because they're more up and down, but women, it's a little less. That is very important. And it's a big indicator regarding other issues that are also risk factors. Indicator to diabetes, metabolic syndrome, having high blood pressure. These are factors that need to be checked. Blood pressure you can easily do by going to your local pharmacy or whatever, or get your own machine. You want to keep it below 120 over 80. Once it starts getting above 120, you might need to start reassessing things. Are you exercising enough? How are you eating? We talked about the preventative measures. Are you doing those other preventative measures? Checking your blood sugar. So part of getting that blood work done is they'll find your blood glucose on the CBC, but a better marker is actually called hemoglobin A1C. And that is looking at how sugar coated your cells are. And that you can't just like fast for a week ahead of time and get it down, because it takes 3 months to change. So that's a marker that really proves what you've been doing for the past 3 months. And that is a pre-marker for
Damn
diabetes.
it, I guess I
Can't
can't
cheat
hide
it.
all my
You can't.
sweets.
You can't
Exactly.
cheat that
You
test.
can't lie on that one. You know,
No.
so that's very important to check that as well. I mentioned before, chronic kidney disease is a high link factor for heart issues. You know, and you think about any of these all cross stress each other. And the other one is a chronic immune disease, any immune disorder, which could be even psoriasis. People don't understand when they have the psoriasis on their skin, that's a systemic inflammatory problem, not just something you put cortisone on, you know, there's something going on. Rheumatoid arthritis, lupus, MS, and even, which we talked about last month, Hashimoto's and Graves' disease of the thyroid is an autoimmune condition. Any autoimmune condition really stresses the heart out.
It's interesting you say that because if you look at it, they all sort of come back to the gut, and the gut is where 70% of things happen, symptomologies occur is in our gut, which is directly connected to our heart. And then no wonder there's all these other complications that happen, right? So
exactly. That's 70. Yep. That 70% is your immune system. And your immune system is going to regulate that inflammatory process in your body. So if your gut is off, and I completely agree with you, and many people don't understand that just changing your diet, it's also about the nutrients you're getting from your diet, which is going to provide a lot of helpful biochemistry in your body. But it's those nutrients and the fiber and not the chemicals, you know, taking all that out, that can help your gut heal. And when your gut heals and your inflammation goes down, the heart disease gets better, but all these other disorders get better. And the gut, you know, I mean, we're going to get on a little side topic here, because the gut, of course, when that is in a dysbiosis state, when it's off balance, it highly affects, you know, the brain. And it's linked to depression, it's linked to anxiety, and depression and anxiety are also linked to heart disease. So, you know, just we can go round and round.
It's a vicious circle.
It is. It truly, truly is. But keeping on the topic of heart disease, so kind of what we're all saying, all these risk factors, is what's considered stage 1 of heart disease. It's called pre-heart failure. You know, that your markers are going in those directions. Your EKGs may be a little off, your blood work's a little bit off, you don't exercise, you have a bad diet, you don't have any symptoms, but you're doing these things. You drink too much alcohol. That is literally stage 1, pre-heart disease. And then stage 2 is often asymptomatic, meaning you don't feel anything, but there's changes. And you can see that change on the EKG. Hence why you want that EKG, because you want to catch this in stage 2 when you still have no symptoms. And often that change on the EKG is because the heart is starting to not be able to pump as much blood around the body. There's something clogging it up, like you're getting atherosclerosis, which is a hardening in your arteries. You're getting some plaquing going on in there, narrowing the arteries. So it's the left ventricular, you know, aspect of the heart. And it's actually called an idiopathic left ventricular syndrome, that it can, you know, be challenging, and it'll decrease that pumping like to less than 40%, but you don't have symptoms yet. So can you imagine you're not getting this extra oxygen around your body? And so when that starts happening, yes, you start moving into symptoms. And these symptoms are your key warning signs to do something now, because stage 4 is a heart attack. So why would you do anything at stage 4? I mean, that's just crazy. That's 911. So stage 3 is already getting scary. And that is where you are out of breath. You're walking to the refrigerator and you're out of breath. That's a bad sign, people. It's not exercising yourself to be out of breath. It means doing a normal daily thing and you're starting to get out of breath. You're starting to feel more tired and fatigued for no reason. Now, there's multiple possibilities for that avenue, hypothyroidism and things like that. But hypothyroidism, you're generally not out of breath. So you're starting to link these together. The other very connected symptom is you start getting swollen feet, swollen ankles, swollen legs, meaning below your knees. That's a decrease in circulation. So your left ventricle is not pumping that blood up around the body and it's starting to pool. That is, you go get your doctor now. You can push like into your body and it stays, like how there's nothing staying there. You measure edema, which you got to really do this more by your ankle, so you would check someone's ankle, like if it's you or your spouse or a friend or your mother or father, and you look at them and you're like, man, their legs look a little bigger, but they didn't really gain weight, but they just look funny. Go up to and push. If you can see a thumbprint, that is edema. That is medical edema, meaning swelling there. You need to do something. That doesn't mean they're having a heart attack right now. They could have a little bit of kidney problem, decrease the salt at that point. So that's also one of the preventative measures, is even though salt is very good for us, once your body crossed over into an inflammatory stage, you got to start being careful, because now your kidneys can be off. It's not doing what it normally should do when it's healthy, with salt and potassium and magnesium. So there starts becoming some other issues, and you got to start walking this fine line of making sure you get enough fluids and decreasing your salt. But those are like the main signs for stage 3. Stage 4, of course, is a heart attack.
When you were talking, sorry, my video is cutting out, but I think
Sure.
anyways, but hopefully I can hear me. But when you're talking about like the swollen like legs and stuff like that, does that have anything correlation to having always cold limbs? Because isn't that circulation as well? Like if you have cold hands, cold feet, maybe your extremities are always cold no matter what you do.
Yes. Having the cold limbs is an autoimmune condition.
Okay.
So, my gosh, the word is on the tip of my tongue. I say it all the time. What
Reynolds?
Yes, syndrome. It's pronounced a little bit different, but
Raynaud's
Raynaud's syndrome is generally, ironically, linked more to hypothyroidism and an iodine issue. So talking about iodine, improving someone's full body saturation of iodine, which of course, iodine overall is great for the heart because it's helping the rest of the body. But that's the same thing as if we went into a conversation about healing the gut, how that helps the heart.
That would be a great future show. Just talk about like the Reynolds or
Raynaud's. Oh, definitely. Yeah. So that is a circulation change, but that circulation change isn't necessarily coming from the heart. It's coming from an autoimmune reaction in the vascular system. But that's a great question.
So I've got a question for you. We're almost coming to time, but there's so many factors that affect our heart medically, but what about like in terms of social? What about, like now we've sort of been all confined to our homes. So how does that affect our heart? Like, our social atmosphere, our work atmosphere, our vitamin D levels, all of that.
Yeah, those are all been recently more researched. Well, some of the studies were out in 2016. So they already were given a pre-warning of what was going to be happening to us. But, 5 really surprising risk factors that people don't think about. One, they found these studies on loneliness. Just being alone and isolated from others puts you at the same risk factor as if you were overweight or a mild drinker. I mean, that's just crazy. Being indoors, which is creating a lack of vitamin D, but also being indoors also means generally inactivity or a lower activity level is also studied to show increasing your blood pressure, increasing your cardiovascular risk. Sitting, so that's become more well known because that's very linked to diabetes as well, which having diabetes is very linked to having heart disease. And ironically, having heart disease actually links back a high risk of getting diabetes. So it all goes together. But sitting at your desk more than 10 hours, it leads to back to the inactivity. We're not getting the recommended 150 minutes of activity a week to help our heart. And of that, for the heart specifically, 75 minutes should actually be pretty intense. Mm-hmm. So intense for you. So intense for you means, you can still talk while you're breathing, but it's intense. So it's going to be different. Someone's a super athlete, their heart rate's going to be really high. If you're not at that point, your heart rate is a lot lower, but it doesn't matter what that number is. It's intense for you. So you need to have your intensity up for about 75 minutes a week So you're using that heart muscle because you have to stress the heart to, a little bit damage it. That's like weightlifting. So the heart can go in and repair itself. And when it repairs itself, it gets stronger. So you need to have that together. So definitely those. And a weird side note too, are getting teeth work done, root canals. Most people are familiar. If you're going to have some dental work done, the dentist will give you an antibiotic. And that's a whole other discussion regarding antibiotics. However, I truly believe in this case, it is important to take it at that time because it's a very dangerous bacteria that lives deep in our mouth. And it either gets disrupted with that deep dental work and it gets into potentially our systemic blood supply. And these bacteria love to go inside the heart and get on these little cords, chordae tendineae, that hold on our heart valves. And then, 5-10 years later, you have some major heart problems. You don't even know why. So that and root canals. So you got to be very, very careful of that. Mm-hmm. The other factor is unemployment. So, this is what we've been going through for 2020. Our loneliness, we've been indoors, unemployment, we're working at our desk more. You're not getting in your car and driving and walking around the office, whatever it is. So it's pretty scary. The heart disease is probably going to go up. So we really got to focus on our prevention measures, which I want to go over that really quick. We did talk about exercise, make sure we're getting that done. Get your blood work done, your EKG done, that's preventative. Sleep, very important. Trying to get those 7 to 9 hours of restful sleep. If you do have any sleep issues, you keep waking up, that has to be addressed. Talk to your physician, talk to someone. On your own, just do some de-stressing techniques. Maybe that in and of itself is all you need. The other things is your diet. And we need a lot of nutrients, like we talked about, B vitamins, and especially folate for the heart. But there are studies, regarding the Mediterranean diet and increasing our omega-3s, which is, through salmon, but always think sourcing. So wild caught salmon or any oily fish, but what is the source of it? Walnuts, chia seeds, flax seeds, sacha inchi nuts, which come from South America or in Asia. Amazing omega-3 profile, and they're a complete protein, which is really cool. Getting your berries in and eating your dark leafy greens. Those things specifically, very important for your diet. Of course, eating plant-based overall, sourcing organic, all that kind of stuff always comes into play. And then the last thing I want to mention, heart disease, we generally think of men, and we know women also, get heart disease. Of course we do. And other, it's mostly studied with the white male. So, this can go to another topic that other cultures need to be studied regarding their risk. But for the risk of women, heart disease is the number one killer of women. We think of, breast cancer, it's a heart disease. So women need to look at all these factors as well. But our own risk factors come from hormonal imbalances. So that often, if you started your menstrual cycle young, or if you started it way old, that's a risk factor. If you have polycystic ovarian syndrome, it's a risk factor. If you yourself were a preemie, it's a risk factor. If while pregnant you miscarry or have a stillborn birth, it's a risk factor. If you have preeclampsia or the high blood pressure during your period, it's your risk factor long term. So all these things are really important. And then even fertility treatments, that's usually a short-term risk factor because during that time things can happen, but long-term, they're generally okay, try to do the other things. But even birth control use, how long have you been on it? Things like that. So that's a complicated topic, risk versus benefit. But so you better modify other lifestyle choices to help prevent things. So I just really wanted to throw that in there regarding women and make sure their hormones are balanced at every age because it will affect their risk of heart disease. And that is the number one killer for women.
I totally didn't know that. I'm being the guy on the show. I didn't know that was the number one killer. But you know what?
Gotta get it in there.
But also we want to put out there that, what Dr. Theresa is pointing out, consult with your specialist, right? Always just, this is just a educational talk show. And
open your eyes.
Open your eyes and just kind of get some information and take it back to your cardiologist, your medical doctor, whatever specialist you're seeing. And so, if you want to start asking questions or if you have any pre-existing conditions or even just want to ask questions like Dr. Theresa says, ask questions. That's what we're here to do is ask questions, educate ourselves. Talk to a specialist because Dr. Theresa is not here to, ask you to do anything other than outside what your medical practitioner is helping you with.
Exactly.
Excellent. It was an amazing show. I mean, we could keep going on and
Yeah,
on
so
and
many-
on. But
On and on and
Topics
on.
came up. You just gave us so many topics to kind of
I
cover for
know.
the rest of the year.
Okay, so coming up on the 24th, we've got Sue Ward. She's going to be she's a nutritionist, and she's going to be talking about vitamins, how to pick your vitamins, how to source your vitamins, everything about vitamins. So if you have any questions, please put those in the comments. Then on March 4th, Friday the 4th, we've got Dr. Farine Korji coming in. She's going to be talking about skin health. And then we've got Dr. Theresa coming back in on Wednesday, March 16th, and she's actually talking about autoimmune disorders. So that's perfect.
They all link together. Yes.
And then we'll let you know of the other topics that we have. And again, if you haven't already joined us, we are doing the Gratitude 1000. So John, you realize we're at day 46 of Gratitude 1000?
Yes. 46?
Yeah, 46.
46?
Wow.
Yeah, I think we are. Yeah, because we started on January the 3rd.
Yeah.
Right? So 46 times 100, right? 100?
Yep.
So 40,
So it's
no, 430.
46 times 10, so that's 460
60
different gratitudes so far. So for those of you who are wondering what a Gratitude 1000 is, well, it is being grateful for 10 different things every day for 100 days. So we'll have 1,000 different gratitudes, and by then we'll also have created a habit. And so you can join us. Make sure you tag us and use Gratitude 1000 and the Healthy Way Vibes as the hashtag, so you can still join us in that. We'd love to see that. And we look forward to seeing you. If you have any questions, comments, please put them below. If you haven't already followed us, follow us. We are the Healthy Way Vibes on everything. And make sure you do share this if you found any of value. Thank you again for tuning in, and have a wonderful day. Bye for now.
Thank you. Thank you,
Bye.
Dr. Theresa.